Hello and welcome to a presentation on Dr. Betty Hart. My name is Abigail Sexton. Dr. Betty Hart was born on July 15th, 1927, and then died September 28th, 2012 of lung cancer. She graduated from University of California, Berkeley, and then went on to Washington University, and then finally Kansas University for her doctorate. Then she later became a professor at Kansas University and did her research through that university. Typically, her research partner was Dr. Todd Risley, and her focus was early language development. So she was a researcher who worked with families to understand the language development between different populations, in particular with the difference between higher and socioeconomic groups and how that impacts the language development. She was interested in, she saw that there was a difference and then noticed that it was better to start earlier than later. So that is why she was interested in toddlers and preschool and before that age. Because as a former teacher, I know that sometimes it is hard when children are stuck in their ways and things to get them to progress in later grades than it would have been easier to do so in earlier grades. Her research has been used through behavior analysis and in the educational field, primarily preschool age. The first article I looked at was the correlation between overcrowding and the language development. So in this article, she did a longitudinal study, or no, she wanted to do a longitudinal study on this, but this was not a longitudinal study. To look at the difference on when children are in a crowded house versus when they are not in a crowded house. And she noticed in this that it did not matter whether they were from a higher socioeconomic group or a lower socioeconomic group. Those who are in crowded houses typically have a lower language development um, level because the parents typically are overwhelmed and therefore they socially withdraw themselves from others, including their children. So then they talk to their children less, as well as they encourage their children to talk less because they want less noise because it is very noisy in crowded homes typically. Um, so that both the child is receiving less quality conversation skills, and then they are told to talk less. So the parents might tell them to go in your room, be quiet, I'm tired, all of those things that that lessen their conversation skills. The next article I looked at the progression of language skills. So in this study, there was a preschool that she worked or was involved with, the Turner House Preschool that was in Kansas City. And it was a preschool that was primarily for impoverished children in Kansas City. Um, and she looked at the language skills of that daycare, but then she realized that the children were in a way were older um, than their language skills developed at. So she wanted to look at what was it like in their homes, as well as looking at the time before their 4 years of age. So then looking at children of ages 1 through 4, so before preschool, and how lower socioeconomic groups impacts the language development skills. The next article I looked at was looking at the Down syndrome language development. So as those who work in ABA, we typically know that certain groups do have an increased, are behind in language development. So certain disorders. So for example, two disorders might be autism and Down syndrome. So with this one, she was looking at, she did a longitudinal study with 42 children and 9 of them had Down syndrome. So it was discussed that those with Down syndrome have language difficulties because of several different reasons, including their cognitive deficits that they might have, motor control of the mouth. So whether it's their tongue or their palates, they might have issues with those things. They might have frequent ear infections, which then therefore means they have hearing loss. And when you have hearing loss, you might not hear the words correctly. And as well as the parent perception of their child's abilities. The parents may not believe that the child can do certain things and therefore would not push for their child to do those things. And then they might not achieve as much as they might be able to if their parents had higher expectations of them. It was determined that those with Down syndrome typically do develop um, their language skills, but they just do so at a slower rate than their neurotypical peers. Another article I looked at was, what do toddlers talk about? And in this study, it was a longitudinal study that looked at what toddlers talk about between the ages of 13 and 36 months. They were observed in their homes to see what words they talk about, how they communicate, how their parents communicate with them. And then those words were categorized into groups. They originally had a lot more groups and they realized they needed to merge certain groups together. And the typical, as most studies, their socioeconomic group, gender, race, and number of siblings was noted in the graphs to be able to see how that correlates with their language development. It was noted that what the toddlers talk about, it does change based on their language development and as they continue to progress. One of her best known things that she is known for is the 10-year longitudinal study to discuss the outcome looking at language development and the socioeconomic factors. So looking at the socioeconomic factors and how those that come from a lower socioeconomic level differ from those who come from a higher economic level. It was determined that their parenting styles are different. Lower economic group children are exposed to less complex vocabulary and then they're discouraged from talking. They might have ones from lower economic groups have fewer early language experiences, and then as a result, they usually do score lower in school. And how all of those factors continues to determine the language development. This article, it very much impacted me because as a former teacher, I've seen those differences. And looking at when I taught first grade versus fourth grade, it was much more harder to catch up kids in fourth grade than it was to catch them up in first grade. So then even more so, if we are able to catch up kids that are from lower economic groups in earlier grades, so even preschool before first grade, then maybe there won't be so much of a gap between their educational and language development skills because this does severely impact their education beyond. So if she was still alive and I could ask her questions, I would ask her, what type of educational programs would you support with children and toddlers in language development? So that might change from what she looked at in the past versus now. Number two, what do you recommend for parents who are from a lower socioeconomic group and live in a crowded home to help their child's language development? Some people, they can't change this and it is what it is. So what can someone do? Three, would you recommend ABA for children who are behind developmentally in language? Four, do you believe classes should be based on their levels, or do you believe in a mixed abilities classroom? This is definitely a question that it comes up in the school system now to this day constantly. And five, if you were still alive in 2021, do you believe that we have made gains in the language development field, or do you think there's more work to be done? And simply, what would that work be? What do you think we should do? Thank you.